Good morning, everybody. Today, you get to be part of a record-breaking crowd to raise over $500,000 net to fight cancer.
Last year, Stephanie invited everyone to participate in the golf tournament, and Harley employees usually step up and volunteer. And last year, I ran the Tiger Hole.
There's not a volunteer event that Harley Marine Services does that doesn't include Jim. Jim is always the first one to give his time. He's one of the biggest champions of a lot of the community service work we do here.
And so I was just doing my bit to volunteer. I thought it was kind of cool to raise money, and I think I pushed people and got an extra $5,000 or something like this, and so it was fun.
The pendulum swings back and forth, and things come your way out from left field that you never expect. Last year, Jim was a volunteer at our golf tournament. This year, because his wife is being treated by that group, he is technically now a beneficiary of that.
May of this year, I was diagnosed with breast cancer from a typical mammogram, and I was surprised and shocked and needed to get things in order, and so immediately I knew I had to find a really good oncologist.
You think about what your doctor is going to do for your wife. I mean, the diagnosis of breast cancer it's traumatizing and completely changes your life. I mean, one minute we're thinking about a vacation and traveling to the East Coast, and then all of a sudden the brakes are put on everything. And so you want to find the best care possible.
Anybody's illness is a very private matter, but we're family here at Harley Marine. And Jim came to us and told us that Ellen had been diagnosed with breast cancer. And the first thing that came to our mind was Dr. Kaplan. We have to get Ellen to see who we think is the industry's best in this field. Dr. Kaplan, Dr. Kaplan, Dr. Kaplan.
My name is Lorna Stern. My husband and I had been married, probably about 48 years prior to his diagnosis of throat cancer.
I was extremely confident and happy that we were able to get my dad connected with Dr. Kaplan. It was a long, rough road prior to us being able to do this. And it was huge. It was huge for our family and for my dad.
He was able to develop a great rapport with Dr. Kaplan. I mean, there was a significant trust that was created.
The care at the Swedish Cancer Institute from the very beginning is an example of how they take a patient, and particularly Dr. Kaplan, it's all about the total care of that patient.
In oncology, the cancer problem really dwarfs everything else. And not only that, it affects every other medical system. So if you're an oncologist, if you're going to do a halfway decent job, you kind of have to take over the care of the patient. And you kind of become the patient's primary doc as well as specialist, and you really get to know people. And that's, I guess, the way I approach oncology is I'm supposed to be there to take over, and I will have to obviously work with many other doctors, but you're the quarterback. You have to coordinate everything, everybody, and you have to be there. You got to be there for people.
Seeing Dr. Kaplan, meeting Dr. Kaplan, put me more at ease with my diagnosis than anything and anybody has ever done. He is a man that has just been considerable in helping me move forward with my new journey. Can't say enough about how that beginning put me in a place of great hope and in a place that I just felt like I was going to win this battle.
Our goal is to ensure that we have the most current, the newest treatments available for our patients. And that really means going an extra mile to ensure that we can make that happen.
I think what this kind of research does is hopefully it's going to speed the development of new treatments, and not just chemotherapy, new treatments of all kinds, so that we're going to hopefully accelerate the process. We're going to be able to develop drugs faster, get them available to patients faster.
So everything that he's going to do is going to have an impact one way or another on the lives of myself, but also the lives of thousands of people that are impacted by that.
We have become affiliated with this cause in a very personal way this year. My wife was diagnosed in January. My lifelong industry has actually chosen, through Harley Marine to take this thing on because it's such an impact to us now that we're in the middle of this fight, that all the fundraising and the research that comes from that, my wife is a direct beneficiary.
Historically, the government has funded a lot of research. That is changing, and as our research is continuing to expand, we are relying more and more heavily on support from organizations like Harley Marine Services. That is just extremely important.
I don't want to have a company that's just known for marine transportation. I want to have a heart and soul and a face of the community. Seattle's a great city. It's a generous city. So to maintain that, you have to always look at enhancing the community in every way you can.
The funds from Harley Marine Services that were donated last year have gone to support a research nurse this year, as well as the Breast Research Registry and a lot of the work and papers that come out of the Breast Research Registry.
There are millions of cancer charities all over the country, but we felt like we wanted to be involved in one that affected our local community. If you think about Jim Fleece, Jim and Ellen, last year Jim was a volunteer just like we are, and this year he's in the trenches.
The year that Jack passed away, I thought, well, I'll start giving to Dr. Kaplan's research fund. So I did that I've done that every year since then.
This year we decided to increase it to $100,000 in hopes that this will inspire others of you to give as much as you can to help Dr. Kaplan in his research efforts.
Now I'm not just raising money for Todd Profit and some doctor that I've never met. Now it brings it home, and so it really makes it much more personal. And you never know when cancer can strike your family, because it can strike anybody.
Cancer is something that affects more than the person that's been diagnosed. It's a diagnosis that affects family and friends and loved ones, and cancer is everywhere. And so many people have cancer, and it's something that we need doctors like Dr. Kaplan to help us to gain more research for prevention, research for treatment, and research just to get a handle on this cancer that is just affects so many people. And I feel like not only Dr. Kaplan's knowledge and his understanding is so important for our community, but the compassion that he brings and the hope that he brings to his patients. And I know other families that have had relationships with Dr. Kaplan, and they speak so highly of him because he is just so good at what he does, and he's such a loving, compassionate doctor that we need more Dr. Kaplans, definitely in oncology, but we're really, really lucky to have Dr. Kaplan here in Seattle and in the greater community.